Just to advance what Dr. Knott was saying, since we can't bring this to you, or we can't have you come here and see what we're all about and have a whole day to spend with you to relay this information, we've tried to put it as concise as possible so that you have all the facts that you need and an understanding of our fellowship going away from this half-day interview session. So I'm going to kind of provide some background information, and Doctors Knott, Park, and Badran are going to fill in as we try to all convey to you our fellowship. So the objectives are for you to gain some knowledge about UCSF as an institution, if you're unfamiliar with it, and of our Department of Otolaryngology, Head and Neck Surgery. And then most importantly, to gain an appreciation of the Facial Plastic and Reconstructive Surgery Fellowship, along with critical details and an understanding of the experience that comes with it. And lastly, we want to give you some insight into the beautiful living and fun living that San Francisco has to offer, potentially for a year for you. I don't know how much U.S. News and World Reports really mean or translate to, but if they do mean anything, we typically, as an institution, fall within the top 10 of all hospitals in the country. As an otolaryngology department, we're this year number 13. In previous years, we've been in the top 10. There's been a restructuring of how that survey is done, and so we anticipate that we'll get back to where we were shortly. As a medical school, we're very fortunate to work with some of the best med students in the country. They help us out quite a bit with research in particular. We're a top 10 research university, along with being second in the country in primary care education. Amongst NIH-funded OH&S departments, we're always amongst the top 10 of them. Our department is robust. We have a lot of clinical faculty who do clinical and research, and then we have dedicated research faculty as well. Our residency program is 5 residents per year, and we have fellows in multiple fields. All in all, we have 35 clinical faculty members, and we've hired another 2 or 3 before COVID who will be joining us to increase that number. We've got about 15 research faculty, quite a few physician assistants and nurse practitioners, and then essential components of an otolaryngology department like speech pathologists. And unique to UCSF, we have quite a number of sites that we work out of that we'll try to describe to you. Daniel, would you like to add a few words there?
So UCSF has a long history of facial plastics. It was defunct, however, starting in 2007 until 2011 when I came here from Cleveland Clinic to start up the division again. With the ability to do flaps, of course, the division grew really quickly. I was drowning in flaps and cases. It's like a little boy in a toy shop. There's no one here doing Mohs, no one doing aesthetics, rhinoplasty, no one doing facial reanimation, and no one doing free flaps when I got here. So basically everything I love, they had a need for. So I was luckily able to recruit Dr. Seth to join me in 2013. And then he very rapidly also was being drowned in work. He's an extraordinarily capable guy. And so he's been sought after in all kinds of ways for our department and the medical school. And so we were even more fortunate to be able to recruit Dr. Park to join us 2 to 3 years ago. So And that's what I mean. Every few years, we've been growing in leaps and bounds. So now it's really fun. There's the three of us, and we began the fellowship 5 years ago, um, because we'd be training our chief residents and training the head and neck surgeons in microvascular, but a lot of them didn't want to go into it. Now that's changed a little bit. They are also interested in micro, which is definitely a positive thing, because you don't want to be doing only 120 free flaps. This is not solely a microvascular program. We're offering you everything. So we think that the number between 60 and 80 flaps in a year is a great experience and a good breadth, and will set you up to be successful should you want to do that in the future. But it shouldn't be your only experience. And so you have time to delve into all the different things that we offer.
Fantastic. With that introduction to the program, we're going to go over, an overview of some of the logistics aspects that you all should know. Our fellowship is a one-year fellowship. We have had a two-year fellow who is required to do so due to the military. University of California benefits are given to the fellow, which includes full medical, dental, and vision insurance, including extensions to family if needed. Malpractice coverage is included as well. Salary is a standardized California PGY-6 salary that's adjusted for cost of living. There's also a moonlighting opportunity with a hospital system in the East Bay called John Muir that sometimes needs coverage that can get some additional funding for you and your family if applicable. Requirements to be a part of the fellowship is to have an active DEA and a California medical license, which, given the time it takes to get the license, we start you on that pretty soon after matching. You do get vacation days, 20 total, that are granted to you. You don't have to take all of those, but that provides you some room for mindfulness and interviewing, etc. You do take call. You join the otolaryngology attending call pool, and that equals out to about 2 to 3 weeks of call per year. In all honesty, most of those fall during the holidays potentially, and that's divided amongst most of the fellows. You do not take any pediatric otolaryngology call. There's a big pediatric otolaryngology program here, and they have their own fellow. Additionally, there is no such thing as an aesthetic patient pager, so you're not stuck with the responsibility of dealing with aesthetic calls on a 24/7, 365 basis. I'll let each of the faculty tell you a little bit about where they trained. I know Dr. Knott got into that just a little bit, but Daniel, would you like to?
Oh, sure. Thanks, Rahul. So I went to med school at UCSD, did a 6-year residency at Cleveland Clinic. We had 1 research year, so I did research on rat laryngeal transplantation. I did microvascular basically the whole year. And then I did my fellowship at UCLA, and then returned to the clinic for 4 years to be faculty before I came out here to UCSF. Rahul?
Thanks. I likewise I went to residency at the Cleveland Clinic, 6-year program, 1 year with the research, did rat facial nerve research. And my medical school and undergrad was at the University of Rochester in upstate New York. I went to UCLA as well for my fellowship. You'll see that as a common trend here. And then joined UCSF faculty in 2013. Andrea?
Yeah, thanks. So I think you guys hired me to give you a little bit more of a different Midwest flavor. So I did my residency at WashU in St. Louis. I actually did a T32 program, and during those 2 years, I did a lot of laryngeal nerve research as well, and kind of characterized some nerve injury models. And then after that, I went to fellowship at UCLA, and then ended up here.
Great. So the three of us are pretty active and busy. We have about 2 to 3 operative days per week and 1 to 2 clinic days per week. And basically, over the weekend, you kind of figure out where you want to be for the following week and make that schedule along with the chief resident and other fellow from head and neck. And we kind of let you choose your own adventure and maximize your experience. The fellow does have a fellow clinic for facial plastic patients. During the first half of the year, you kind of round up and gather patients to operate on while doing cosmetic injections in the clinic and evaluating patients. The second half of the year, you start doing operations on your own patients and managing these patients on your own. So that's a wonderful opportunity to build some autonomy in a guided way because we're always nearby. We have very close relationships with other departments, including dermatology, oculoplastics, and plastic surgery. The dermatology folks do a lot of Mohs cases and send a lot of reconstructions our way, but they also do a lot of injectables and lasers and have all the newest technologies. So it's really great to see how they do those things. The oculoplastics team is about 4, and they're very busy, have a fellow as well. And their fellow kind of go back and forth learning from the different services. The plastic surgery team, we also have a good relationship with them. They have a microvascular fellow who sometimes comes and helps us out with head and neck cases. Our fellow is welcome to go to any of their cases as well, including cleft lip palate, microtia, etc. We try to keep these relationships very positive to benefit our fellows broadly. I think Dr. Knott probably has a little bit more to say about that.
Yeah, we have worked hard to maintain really positive relationships, as Rahul said, with the other divisions. So I don't know about what it's like at your programs, but the plastics department and ourselves are friends. We do research together. We collaborate on projects. We give them tissue samples for their research laboratories. We're on their papers. They're on some of our papers, as we are with the Mohs surgeons. We attend their monthly visual tumor conference where they bring all their most complex cases. Plastics isn't there, we are. It's always been that way since I've been here. And so it's like a open door policy with their needs. So they send us a lot of their repairs, and then their fellows are allowed into our ORs and to be as involved as they want on our reconstructions. And as Rahul said, we train their microfellow in head and neck to the level that they want to be involved. They're like a third tier fellow, because our microfellow in head and neck and the facial plastic microfellow are kind of like equals. And they arrange and share cases, and it tends to be a really nice, supportive, collaborative relationship between the two. Each one wants to do some, but not only flaps. And then the microsurgeon in plastics kind of fills in the gaps here and there to their level of interest. So it's a really nice kind of fluid dynamic where people are looking and able to find their own experiences and craft their own weekly schedule.
Thanks. Karam, do you want to add or discuss your experience at the county hospital and with working with other private practice physicians in the area?
Absolutely. So I'm at the Zuckerberg General Hospital, which is our county hospital. It's the kind of health net hospital for the city of San Francisco. I'm there scheduled about one time a month. As cases come up and residents let you know about them, it moves to 2 or 3 times a month. And it's really, you're going not only to help teach residents, but also if cases come up that the residents think are interesting to you, then you are welcome to go there, but you don't, I never felt like I really was forced to. It was only kind of a symbiotic situation. There's plenty of cases to go around at Mission Bay and Zion, so Zuckerberg is a supplement, and it's been a nice one. It's a complete autonomy there, and you're walking residents through cases and making sure that everyone stays safe. The private practice has been very welcoming. So Dr. Mehta is in the South Bay. He has a very robust rhinoplasty and fillers practice. And the same thing goes. If it's educational to me, I head down there. If I feel like the case, breadth that week at UCSF is adequate, then I stay at UCSF. But his practice is very busy rhinoplasty, and his techniques are just like most surgeons, unique to him, and it's an interesting and kind of addition to the practice. Additionally, Corey Moss is around the corner here in San Francisco, and he's been super welcoming about visiting and observing as well. So I think that there's plenty of cases at UC, and the general is definitely nice. If you enjoy teaching, it's a great place to be.
Great. Would you say most of your cases there are of what type?
Oh, so the majority are rhinoplasty. There's very little trauma. I mean, the city of San Francisco has stoplights everywhere. There are some bike accidents along the way, but the providers at the general are all very well trained in trauma, so they don't need you there. So the majority of cases are elective rhinoplasty cases. I've been able to book some facelifts and necklace, and it's been all facial plastics.
Great, thanks. I had mentioned that we have a number of campuses. I'll be referring to them by name, so just so you kind of know, Parnassus is kind of our tertiary medical center. So where all the big medicine admissions are, and the majority of services. The neurosurgical cases, combined neurosurgical cases that need reconstruction or skull-based cases are the ones that we're typically pulled over there to perform. On average, each of us probably operates there maybe once or twice a month. Mount Zion was just an ambulatory surgical center and is now, with COVID, been converted to a short stay hospital, essentially, where patients can stay for several days. And it's where we have our main facial plastics clinic and where we do our main facial plastic surgeries. So we spend a lot of time there. The other place we spend a lot of time, and you will too as a fellow, is Mission Bay, because this is our cancer center, and most of our reconstructions and free flaps are performed at that location, along with even rhinoseptos and Mohs reconstructions and facial nerve work is done there as well. Karam spoke in detail about the general hospital. You don't go to the VA that much unless there's a special need, and the Children's Hospital is at Oakland is one that we don't go to as well. I will add that Dr. Park is at the VA a couple times a month, helping the staff facial plastics cases there. Your main locations are spread throughout the city. The city is pretty easy to get around, although traffic can sometimes be a big issue. You spend the most of your time, like I had mentioned, at Mount Zion, Parnassus, the General, and Mission Bay. So this can kind of help you find a place to live. There are shuttles, free shuttles that connect each of our hospitals. So it is possible to even not have a car and live in San Francisco. One of the things that we take the most pride in is our case mix. We have breadth and depth in virtually all aspects of facial plastic and reconstructive surgery, and which is why we refer to our fellowship as an advanced fellowship in facial plastic surgery. We provide microvascular reconstruction with basically every flap: ALT, fibula, forearm, subscapular, gracilis, etc. Mohs reconstruction of every type. We basically get most of the facial reconstructions referred to us from Mohs surgeons at UCSF and throughout the area. Facial reanimation, we do every aspect of, whether that's for radical prostatectomy, static, periorbital procedures, gracilis, nerve transfers, etc. Rhinoplasty is extremely commonly performed, functional and cosmetic. Aging face is a rapidly growing aspect of our practice, and one that we're trying to grow even further. Facial feminization is a unique aspect compared to other fellowships, where we do quite a bit of facial feminization, as the city of San Francisco and California, for that matter, do approve this through insurances, particularly the state insurances. So that leads to a lot of patients and a lot of opportunities. So for the last 4 to 5 years, we've really developed this program and are actively doing quite a bit of research and writing in the area. Facial trauma, Karam has already mentioned, it's not a major part, thankfully, of the fellowship, although we do see some trauma, enough so that you can continue to gain knowledge of it beyond your residency. And then, of course, all the different injectables and basic laser procedures and PRP are offered within our facial plastics clinic. Daniel?
So, as Rahul said, when you're in a place like San Francisco, or each place, I should say, has a certain population or advantage to it. And San Francisco certainly is the transgender or gender non-conforming individuals. So that's been, as Rahul says, a real area of growth for us. It's been a really fun area to start to work in. I've never understood the face, cephalometrics, beauty, rejuvenation, anything like I do now until I began to do this work and see my results. The patients love the work you offer them. It's you radically transform a face. It's a super powerful techniques you learn, and so it's also a lot of fun. So I think that's been a really transformative part of our experience, and that everything we offer kind of layers one on top of the next. Doing a facial nerve, doing cervical facial flaps for Mohs reconstructions, doing facelifts, doing facial reconstruction. The knowledge just starts to grow and on itself, and layer and layer and layer, and you build a really stable platform for your knowledge base, which I think is really neat. So I think that's our main strength. Thank you, Rahul.
So that's a picture of a frontal table setback for frontal feminization. And here's some radical prostatectomy with nerve grafting and ALT free flap on the left and fibula flap on the right for mandible reconstruction. This is a picture of the temporal bone lab for our residents. That doubles as a microvascular rat lab that we do every fall, summer, and as a facial dissection course that we do there as well for our residents and fellows. So lots of internal courses that the fellow helps us arrange. There's also plenty of local courses as well, one up in Tahoe, national meetings, etc. And we encourage learning in these activities. Of course, living in San Francisco is a very pleasant thing for a year. It's a great city, offers a lot from food and restaurants to nightlife to outdoors activities. All the neighborhoods are very interesting and carry their own flavor. People are able to kind of choose where they live and still get around the city quite well, typically through Craigslist is how they rent an apartment. UCSF does offer campus housing. Karam actually right now is in campus housing. I'll let him say a few words about that.
So there's a number of communities that UCSF has set up housing for students and postdocs, as well as residents and clinical instructors or junior faculty. I'm living actually in the Mission Bay part of town, which is just across the street from our Mission Bay Cancer Center. And the housing situations in each of these communities throughout San Francisco are much more affordable than the median renting price throughout the city. And the amenities are new. I mean, I'm in a building that just was built. Maybe it was actually being built as I started my fellowship. It's a month old, and it's under $2,000 for a studio. And they have different pricing situations based on the space. So it's all convenient. And there's also shuttles that pick you up from each of these communities to all of the UCSF affiliated hospitals, which makes being a fellow very convenient.
Of course, just right outside of San Francisco, you've got Napa and Sonoma vineyards. You've got great water sports right in the Bay, and you've got great hiking both in the East Bay and up in the Marin North Bay area. Really unique environment, especially for the outdoor enthusiast. And for sports fans, we've got great sports here in the Bay Area with multiple teams winning national championships in the last few years. The Warriors Stadium is actually right across from our hospital. We'll show you that. Niners had a great year last year. There's the Giants and the Sharks as well for our sports enthusiasts. We understand that this is a little bit of a different thing to go through this year for you all, and we encourage you to reach out to and communicate with us. Feel free to get our email addresses or note them down here, and we'd love to continue communicating with you even after the fellowship interviews here so that you gain a really good understanding. Really appreciate you making the time to sit down with us, and I'm going to get cued another video.